A nurse is educating a patient with left-sided heart failure about common clinical manifestations. Which of the following symptoms should the nurse include? Select all that apply. A. Dyspnea on exertion. B. Cough with frothy sputum. C. Jugular vein distension. D. Fatigue and weakness. E. Pitting edema in dependent areas. F. Mental confusion. The correct answers are A, B, D, and F. Left-sided heart failure leads to pulmonary congestion, causing dyspnea on exertion, cough with frothy or blood-tinged sputum, fatigue and weakness, and mental confusion due to poor perfusion. Jugular vein distension and pitting edema are manifestations of right-sided heart failure. A patient is admitted with suspected heart failure. Based on the pathophysiology, which compensatory mechanisms initially occur? Select all that apply. A. Increased stroke volume. B. Elevated heart rate. C. Decreased cardiac output. D. Myocardial fatigue. E. Blood accumulation in the left ventricle. The correct answers are A and B. Initially, etiological factors lead to increased cardiac workload with elevated heart rate and increased stroke volume as compensatory mechanisms. Decreased cardiac output, myocardial fatigue, and blood accumulation occur later as the condition progresses. Which of the following are causes of heart failure? Select all that apply. A. Hypertension. B. Valvular heart defects. C. Obesity. D. Hyperthyroidism. E. Low salt intake. F. Myocardial infarction. The correct answers are A, B, C, D, and F. The causes include hypertension, valvular heart defects, obesity, hyperthyroidism, and myocardial infarction. Low salt intake is not a cause. A nurse is assessing a patient with right-sided heart failure. Which clinical manifestations are expected? Select all that apply. A. Orthopnea. B. Ascites. C. Hepatomegaly. D. Pale, cool extremities. E. Weight gain. F. Abdominal pain. The correct answers are B, C, E, and F. Right-sided failure causes systemic congestion, leading to ascites, hepatomegaly, weight gain, and abdominal pain. Orthopnea and pale, cool extremities are associated with left-sided failure. A patient with heart failure is prescribed digoxin. Which nursing considerations apply? Select all that apply. A. Monitor pulse and hold if less than 60 beats per minute. B. Increases myocardial contractility. C. Dosage of 0.25 milligrams 3 times daily. D. Promotes fluid excretion. E. Slows heart rate. The correct answers are A, B, C, and E. Digoxin increases contractility, slows heart rate, with dosage 0.25 milligrams 3 times daily, and hold if pulse is less than 60 beats per minute. Fluid excretion is the role of diuretics. Which pharmacologic agents are used in heart failure management? Select all that apply. A. Furosemide for reducing preload. B. Hydralazine as a vasodilator. C. Aminophylline as a bronchodilator. D. Losartan as an ACE inhibitor or angiotensin II receptor blocker. E. Statins for increasing cholesterol. F. Codeine as an expectorant. The correct answers are A, B, C, D, and F. Furosemide reduces preload, hydralazine dilates vessels, aminophylline relaxes bronchi, losartan blocks angiotensin, and codeine aids in clearing secretions. Antilipidemics lower cholesterol, not increase it. During nursing management for heart failure, which admission care interventions are appropriate? Select all that apply. A. Admit in Fowler's position. B. Provide a noisy environment. C. Ensure adequate rest. D. Maintain well-ventilated room. E. Monitor vital signs regularly. The correct answers are A, C, D, and E. Admit in Fowler's position, ensure rest, well-ventilated, quiet environment, and monitor vitals. A quiet environment is needed, not noisy. A nurse is planning nutrition for a heart failure patient. Which dietary recommendations apply? Select all that apply. A. Low sodium diet. B. High cholesterol foods. C. High fiber diet. D. Avoid foods high in salt. E. Encourage fluid restriction if needed. The correct answers are A, C, and D. Low sodium and high fiber diets are recommended, and avoid foods high in salt. Which complications of heart failure should a nurse monitor for? Select all that apply. A. Cardiac arrest. B. Brain damage due to hypoxia. C. Cardiomegaly. D. Deep vein thrombosis. E. Coma. F. Improved perfusion. The correct answers are A, B, C, D, and E. The complications include cardiac arrest, brain damage, cardiomegaly, deep vein thrombosis, and coma. Improved perfusion is not a complication. Which etiological factors contribute to heart failure? Select all that apply. A. Pulmonary occlusions. B. Septicemia. C. Infusion overload. D. Emotional stress. E. Drug abuse. F. Healthy kidney function. The correct answers are A, B, C, D, and E. Pulmonary occlusions, septicemia, infusion overload, emotional stress, drug abuse are causes of heart failure. Healthy kidney function is not a cause.